Today, we take a look at Deepak Group and its CSR arm, Deepak Foundation, and the work that they're doing for skill building, education, children with special needs, health sector, and livelihood enhancement to empower the communities, including women of India. Take a look.
With 50 years legacy and expertise in the chemical sector, Deepak Group has firmly cemented its position as fastest growing in the global chemical intermediates market with a people, planet, profit philosophy. Deepak Foundation was started by visionary and founder C.K. Mehta in 1982 in Vadodara. This was before the CSR mandate became a norm in India. The idea was to ensure professional management of charity and social development activities, funded not only by Deepak Group, but also by UN agencies, international donor organizations, and government bodies. Catering to a catchment population of 50,000 in villages surrounding Gujarat Industrial Development Corporation, Nandesari, where the first plant of Deepak Nitrite Limited was set up, to over 4.3 lakh beneficiaries supported under CSR activities across 5 states, the company has remained committed to the cause of shared goals and values.
When Deepak Nitrite started here in Baroda in 1972, every opportunity that the company got to see how it could contribute to its surroundings, it took these opportunities. And there was always a feeling that if you have earned from a particular area, particular location, you should do something to give back to that location. This is the principle on which I would say philanthropy really started at Deepak. Deepak was constantly contributing to the upliftment of the society, be it bringing health care to children, reducing infant mortalities, or working to even see how the mind development of small children takes place through active participation in Anganwadis. Deepak has continued to play a role in their lives to really see how a major change can take place.
Deepak Foundation's foray into emergency transport services started in August 2005. With Safe Motherhood and Child Survival Project aimed at reducing infant and maternal mortality in 2 million rural population in Vadodara. The initiative was documented as one of the 5 best practices in India, beginning with 8 ambulances dedicated to facilitate emergency referral. Gradually, the numbers increased to about 18 mobile health units, providing free of cost primary health care to around 3 lakh people living in the rural and tribal areas of Gujarat, Maharashtra and Jharkhand.
અમારા ગામમાં મેડિકલની એકે સુવિધાઓ મળતી નથી ત્યારે અમારે
We don't have medical facilities in our village. We had to travel 45 kilometers for it. Now Deepak Foundation's mobile health unit comes to our village twice a month. They provide us with free medicines. They also arrange regular blood tests for teenager girls, measure their height and weight, and also provide them with free sanitary pads. On behalf of everybody, I would like to thank Deepak Foundation for their efforts.
દીપક ફાઉન્ડેશન એનો આભાર માનું છું.
Deepak Foundation is implementing 4 mobile health unit of Deepak Group of companies as their CSR project. Strategically, we have selected this particular area where patient has to travel around 40 to 45 kilometers to get a primary healthcare services. So we have implementing this mobile health unit in area called Dugda, which is in Naswadi block of Chotadepur district. In the mobile health unit, we provide OPD services, adolescent clinic, 0 to 5 years children underweight clinic. Apart from that, we also conduct a specialized health camp for tribal communities.
A childcare institute, Samaj Suraksha Sankul, is yet another PPP initiative between Deepak Foundation and Department of Social Justice and Empowerment, Government of Gujarat. The 275-bed facility is a home of visually impaired and physically challenged children in need of care and protection. The institute is home to over 150 children aged 6 to 21 and also operates as a primary school and a learning center.
We took over the management of Samaj Suraksha Sankul under public-private partnership with the Department of Social Justice. When we took over the operations at Sankul, it was a campus of 4 acres with about 15-20 children and a team of 2 staff members. Today, after 3 years, we've catered to over 300 children and have a team of 50 people serving these children. I'm a medical scientist by training, and I see a lot of parallels between R&D and social development. We apply the same scientific methodology in the process of solving social problems. These problems have existed for centuries, and the answer is not that simple, or not something that a 3-year CSR project can solve. But we apply the same scientific rigor. We go in with a hypothesis, collect evidence, and then tweak our interventions as we move on.
As we grew, we also started diversifying in different sectors like education, disability, livelihood promotion. And all these models today are very, very successful experiments that shows result. One of our strengths is research and development. We ensure that all our projects are based on monitoring and evaluation frameworks so that we are able to document the outcome and impact and also the returns to investment. And this has given good results and recognition to the foundation.
Deepak Foundation, under the aegis of the Deepak Group, has also taken the initiative to complement the efforts of the government in the fight against COVID-19 through its 2 24/7 COVID care centers at Nandesari in Vadodara, with state-of-the-art emergency service facilities ranging from 24/7 healthcare staff availability and treatment of COVID patients to round-the-clock availability of oxygen, BiPAP machines, etc.